This program contains content that may be distressing to some viewers, including themes of suicide and sexual abuse. Viewer discretion is advised. Good morning. Welcome to another episode of the Dr. Powell Show. I'm your host, Dr. Keisha Powell. Today we are discussing an incredibly but often silenced issue, suicide and sexual abuse. This is a part one of a two-part series. Today our guest is a well-known expert in the field of sexual abuse trauma and suicide, Ms. Trudy Powell, CEO of Talk It Through Therapy LLC, and a licensed clinical social worker. Welcome back to the Dr. Powell Show. Today, we are interviewing Trudy Powell, a leading expert in suicide and sexual abuse. Good morning, Ms. Powell. Welcome to our show.
Good morning,
Thank you so much for blessing us.
It's my pleasure. It's my pleasure. Absolute pleasure. This topic is important, so thank you for having me.
And thank you for being here. For many of our viewers who are struggling, how does sexual abuse trauma typically present in children, teens, and adults?
This is a very good question, Dr. Powell. I want to start out by giving a little bit of statistics, and then we can go into a little bit deeper into that question. There's a wealth of information available on this topic, but I'll attempt to focus on some key points. Let's begin with some of that statistics. It's estimated that between 12 to 40% of children in the United States has experienced some form of childhood sexual abuse. Unfortunately, shame and stigma often prevent survivors from coming forward and disclosing their experiences. Incest, once considered rare, has become increasingly prevalent. Survivors come from diverse cultural, racial, economic backgrounds. Approximately 1 in 5 women have experienced childhood sexual abuse. From 2006 to 2008, amongst females aged 18 to 24 who had sex for the first time before their age 20, a staggering 7% reported experiencing non-voluntary first sex. Additionally, 12% of girls grades 9 to 12 and 7% of girls grades 5 to 8 report that were abused more often than once, while 57%, indicated that their perpetrator was a family member. Furthermore, 53% of these girls reported that the abuse took place at the home. Sexual abuse in children and teenagers, just giving a little information on that, I'll first start out with recognizing the signs. Children respond to sexual abuse in diverse ways, influenced by various factors. These include age, developmental stage, the nature and the duration of the abuse, their relationship to the perpetrator, their emotional processing and expression abilities, their prior experiences of trauma and cultural beliefs, family dynamics, and community attitudes. Children may not always disclose their experiences of sexual abuse. Instead, you might observe physical signs or changes in their behavior or emotions. Some children may exhibit only subtle signs, while others may not show any signs at all. So let's go into a deep dive into the signs so our viewers can understand that. Changes in emotions. If your child has experienced sexual abuse, you may notice the following. A little bit of fear, anxiety. Your child may seem scared. They may exhibit signs of anxiety, childhood depression, school-age depression, and preteen depression. Changes in behavior. They might become quieter or more distant than usual. And these things you can normally pick up as healthcare providers, parents, teachers, loved ones, grandparents. Usually emotional outbursts. They may cry for no apparent reason or start to wet the bed or soil their pants. Inquisitive nature. They may ask questions like, do people have to keep secrets? They might come up to you one day in the kitchen and say, Mom or Dad, if I have a secret, can I share that with you? They may oftentimes too seem aggressive or angry for no apparent reason. Eagerness to please. They may become unusually eager to please others. They may have loss of interest in activities. Clinginess. They may become clingy and seek excessive attention from caregivers. Let's go right into changes in the behaviors you may notice in your child. Losing interest in activities if they once enjoyed, showing inappropriate sexual behaviors, grinding, rubbing up genitalia, experiencing sleep problems such as nightmares, excessive sleepiness, and even oftentimes wetting the bed. Developing unusual eating habits or overeating, undereating, performing poor in school. They come home with horrible grades all of a sudden when once before they were high performers. Neglecting personal hygiene and grooming could also be a sign. Using explicit language or explicit behaviors. Childhood sexual behavior ranges from developmentally appropriate to harmful. Let me go into some of the physical signs. You may wonder, okay, those are the emotional. Let's go into the physical. Physical signs of sexually transmitted infection in children may include swelling, bruising, bleeding, redness, and irritation of the genital area. They may also experience pain or discomfort when using the restroom, headaches, stomach aches, without a clear physical cause, difficulty walking or sitting, bruising on soft parts of their private area and their buttocks and thighs. Additionally, oftentimes recurrent UTIs if there's penetration and infection. They can also have an infection where there's a discharge from the penis or the vulva. Signs of sexual abuse in teenagers. There's a lot of facts on this, so let me try to sum up as much as possible. Changes in emotions and behaviors are crucial to note. Aggression and apparent anger for no apparent reason. Getting angry, upset, fearful when specific persons or places are mentioned. Trouble developing and maintaining relationships. Crying for no apparent reason. Again, here we are, same as children who are minors and then teens. Showing signs of low self-esteem, signs of depression and anxiety, confusion about their sexual identity. Let's go into the changes in behavior in the teens. Dressing differently, including wearing clothes, shoes, or using accessories they cannot or won't explain. Engaging in harmful sexual behavior such as risky sexual activity, taking increased risks, self-harm, spending a lot of time online and being secretive about their online activity and communications, eating differently, difficulty falling or staying asleep. I'd like to emphasize some physical signs that weren't mentioned before: swelling, bruising, bleeding, redness, irritation, pain and discomfort, difficulty walking or sitting. All of these signs we should be paying attention to as family members. Let's go into adults. We want to explore children, teenagers, and adults. In adulthood, it's a little bit different. Childhood sexual abuse has several long-lasting effects on adults. Commonly experienced emotions including fear, shame, humiliation, guilt, self-blame, can lead to depression and anxiety. Survivors may also experience intrusive or recurring thoughts of the abuse, nightmares, or flashbacks. Additionally, survivors often develop distorted self-perceptions, believing they caused the abuse and deserved it. These beliefs can lead to self-destructive relationships. You may wonder, what are some of the physical effects? Chronic and diffuse pain. Diffuse pain is defined as the pain that's felt all over the body. Particularly abdominal or pelvic pain are common physical consequences of childhood sexual abuse. This abuse can lead to a lower pain threshold, increased anxiety and depression and self-neglect, and development of eating disorders. Sexual effects. Survivors are more likely to have had 50 or more sexual partners, contracted a sexual transmitted infection, and engage in risky behaviors that increase their risk of HIV infection. Early adolescent and unintended pregnancy, as well as prostitution, are associated with sexual abuse. Let's talk about the interpersonal effects of adult early onset sexual abuse. Adult survivors of sexual abuse may be less adept at self-protection. They are more likely to accept being victimized by others. Some survivors of childhood sexual abuse experience minimal compromise to their adult functioning, while others may develop psychological, physical, and behavioral symptoms as a result of their abuse.
Wow, thank you so much for all that data. I'm sure that viewers out there, this is, for those who have experienced and have been victims of, and I'm very cautious when I use the word victim versus survivor, because especially for those who are neurodiverse, diagnosed with a neurodiverse disorders, they sometimes experience trauma differently than someone who doesn't have a neurodiverse diagnosis. And what I have seen where sexual abuse, and I want to make this very clear for our viewers, that if at any point this show has caused any triggers for you, please reach out to the resources that we have listed available at the end of the show. It does present in persons who are diagnosed with disabilities, and I've usually been called into cases where we have to figure that out. What I have a difficulty with is that the resources are not available or readily available for those who have a neurodiverse diagnosis, and not all clinicians readily recognize what is happening. So usually when I'm called in for those cases, I have to find or tailor different aspects of how we're asking the questions or how we're recognizing these behaviors. So thank you so much. What are the long-term mental health effects of sexual abuse, and how does it relate to suicidal ideation?
Another good question there. All right, survivors of sexual violence are more likely to be diagnosed with disorders like major depressive disorder and PTSD. Both of these diagnoses has a significant impact on stress and anxiety. When severe stress and anxiety are present, it becomes easier to experience these intrusive suicidal thoughts and contemplation of suicide. Statistics show that over 1/3 of women who have experienced sexual trauma have contemplated suicide. It would be remiss if I didn't also point out that boys also experience sexual abuse along with these same diagnoses, and oftentimes result in being perpetrators themselves and or struggle with sexual identity issues. I've also attached some statistics for the viewers at the end. While discussing suicide, I'd like to highlight several signs of active suicidal ideation. Here are a few of them. Feeling hopeless and devoid of meaning, experiencing significant changes in eating and sleeping habits, such as not wanting to get out of bed, refusal to go to bed, feeling isolated and alone, having suicidal thoughts. I'm certain viewers will ponder the question of the safety reasons. What should I do if I'm contemplating suicide? The most crucial step in a suicide crisis is to reach out for help. You can call an emergency hotline, go to an emergency facility like a hospital or a mental health agency you trust, or dial 911. Here are some additional things you can do during this process. Reach out to a mental health professional you trust or have some good rapport built with, or your therapist. Find ways to empower yourself. Recognize if you or someone else is in immediate harm. Know your local emergency resources, such as a hospital, 911, or a mental health agency you're familiar with in your community. Seek support from these resources. That's the key.
Well, I think you already told us earlier on about some of the effective therapeutic approaches in treating trauma survivors, but how important is cultural sensitivity when working with survivors of sexual abuse trauma?
Another good question. In the realm of sexual assault and domestic violence, it is crucial to acknowledge the diverse experiences of survivors and the unique challenges they face, especially with underserved populations. Culturally sensitive support and essential resources play a vital role in fostering healing for survivors, ensuring they receive the assistance they need while respecting and acknowledging their cultural backgrounds. Understanding cultural sensitivity involves recognizing and respecting the diversity of individuals and communities, understanding their unique values, beliefs, and practices. Some challenges we face with underserved populations are ethical and racial minorities, immigrants, and individuals from marginalized communities frequently encounter additional obstacles when seeking assistance. These obstacles can manifest in language barriers and apprehension of discrimination, distrust in authorities, and limited knowledge of available resources. It is important to have cultural sensitivity in any realm of treatment. It plays a crucial role in building trust between survivors and service providers. By understanding and respecting survivors' cultural background, service providers can create a supportive environment that encourages survivors to seek assistance.
Thank you so much. Wow. This is very interesting, and I'm hoping that viewers are learning a lot today. What should friends or family do if they suspect someone is struggling with trauma or suicidal thoughts?
This is a wide topic. Let me see if I can concise some data. For trauma, if someone you love and care for has experienced a distressing or frightening event, it can be challenging to help them. It's natural to want to make them feel better, but it's important to accept that they have been through a distressing experience. There's nothing you can say or do to make that pain disappear. That will happen with time, rest, and support. It will help if you tell them that you are sorry about what they've had to go through and that you're there for them in a way that they'll need. It's always a good idea to offer your support to a friend or family member. Here are some suggestions for how you can help. Make time for them. Let them know you're available. Sometimes we want them to move on too quickly, especially when they're going through a traumatic experience. Try to avoid doing this. Don't take their feelings to heart. They may be irritable, depressed, angry, or frightened. Strong feelings and emotional outbursts are common. Don't take it personally. Reassure the person that their reactions are normal. Super important. Offer practical support. You could prepare meals, do household chores, groceries, shopping for them, pick up their children from school, practical things. Let them know you are there for them without judgment. Suggest that they maintain regular daily activities. Talk about the trauma can also be important. Although people who have been through a traumatic experience often get upset when they talk about it, it is very important to share. Some people may want to talk about it right away. Some will allow a little bit of time to pass, but that's okay. One might wonder what are some unhelpful ways to respond to someone who is experiencing trauma. Remember that everyone's response is unique, so don't assume you know how they should think, feel, or behave. Instead, help them to focus on what they still have. Avoid using generic phrases like, look on the bright side, look for the silver lining, as these can dismiss their feelings. Instead, Encourage them to acknowledge and appreciate their current situations. Refrain from judging their thoughts and feelings and don't rush them to get over it. To aid in their recovery, suggest relaxation techniques and enjoyable activities. Laughter. Allow them to laugh. Share jokes, share funny memories that you have with this person. And that is also helpful in the end.
That is very profound, because I have gotten questions sometimes from persons who have survived sexual abuse, who have said to me, I don't think that my feelings were validated. Questions like, well, how did it happen? Or, are you sure? People know when something has happened to them, and the worst thing you can do is ask these questions. Be cognizant of how you are asking a question. Show support, show love, and especially for persons who are diagnosed with neurodiverse disorders, you have to pay attention to the signs, especially if that individual is nonverbal. So, my last question is, what can our audience do today to make a difference?
We all can do something to make a difference, Dr. Powell. We can make a difference by educating ourselves, remaining vigilant for signs and changes in our children's behavior. Sometimes we may need to listen for what people may not say. For instance, if a child who has always been fun-loving and vibrant suddenly loses interest and retreats to their room, it could be a sign of something significant. Additionally, it's important to talk to our spouses, extended family members, teachers, friends of our children. Stay involved in their lives as much as possible. Build rapport with them, not only when they make mistakes, but also when they don't. Trust is essential, so they'll feel comfortable coming to you, opening up and sharing. For adults, make it a habit to regularly check in with your friends and family members. Remember, it's imperative not to judge or dismiss their feelings and expressions. You may never know how they're doing, and a simple phone call can change their outlook on a serious life matter. Often they just need someone to share with, and that can make a significant difference. Finally, tell your loved ones, children, friends, that you love them and that there's support available. Let them know that they don't have to be victims for the rest of their lives.
This is very good. Thank you so much for sharing with us not only the statistics, but sharing with us different things that we can look forward for in order to help those who have gone through so much in their lives. For viewers out there who are still struggling with sexual abuse and suicidal ideations, there is help. I know you are also a CEO of your own company. Could you tell us just a little bit more of the services you offer? And if there's any viewer out there who is interested in receiving these services from Ms. Powell, we'll also post that information at the end of the show.
Thank you for asking that question, Dr. Powell. I am a psychotherapist at heart, and I've opened up my own therapeutic model treatment program. It's called Talk It Through Therapy LLC. I'll give you my website at the end, but what I provide is individual psychotherapy for people who may struggle with a plethora of diagnoses and also substance use diagnoses. What I try to focus on is to go back to the origin. What has happened in childhood? What were the family dynamics? What made you suffer? And work through that in a healing process with all my patients. So, I take my time. I'm very patient, very understanding, and usually there is success at the end. So I'm proud of that work.
We can't thank you enough for the work that you're doing and for the changes that you're helping all these patients who have gone through so much in their lives. Thank you so much again for being on the show.
Absolutely. It's my pleasure. And thank you for the opportunity to share and educate others.
Change starts with us.
It starts with listening and believing survivors.
I want to grow up in a world free from fear.
But harmful norms keep too many silent.
Looking out for one another is our shared responsibility.
Speaking up isn't easy, but it's necessary.
I
want to be a part of the solution.
Consent is not optional, it's required.
Respect for others
is the foundation of every safe community.
Our future depends on what we do now.
On the field or off, we protect each other.
This is our time to make a difference.
United, we build a safer and more respectful world.
A world we all deserve.
Together we act to prevent sexual abuse, assault, and harassment. Learn more at respecttogether.org.
If you or someone you know is struggling, please do not stay silent. Help is available. For suicide prevention, the National Suicide Prevention Lifeline, dial 988 for 24/7 confidential support. This service is available nationwide and it's also available here in our state. United Way of Connecticut 211, dial 211 for free, confidential assistance and referrals to local resources including mental health services are available. For sexual abuse support, call the Connecticut Alliance to End Sexual Violence hotline. Call the 24-hour statewide sexual assault crisis hotline at 1-888-999-5545. And for those who speak Spanish, call 1-888-568-8332 for confidential support and advocacy. For those who struggle with autism and sexual abuse trauma, reach out to Powell Therapy Solutions, LLC. Contact us at powelltherapysolutions@gmail.com for more information here on the Dr. Powell Show. Remember, reaching out is a vital step toward getting help. You are not alone and support is available. Thank you for joining us on the Dr. Powell Show. In our next episode, we'll have part 2 and continuation of suicide and sexual trauma abuse. To sponsor the show or to help other programs, donate to Community Voice channel at this QR code that you'll see coming up on the screen.